All right, lymphatic system. So we briefly touched on the lymphatic system in the previous chapter on cardiovascular system. So its role is in fluid balance, making sure you have the right amount of fluid in your system, absorbing fats. It also has a function for immunity or defense. The lymphatic system is made up of lymphatic vessels, and they are a one-way system. Okay, they only move in one direction. They start out with lymphatic capillaries. And these are tiny vessels that are closed on one end. And they essentially absorb or take up excess fluid in your body. We call that excess fluid in your tissues lymph, hence lymphatic system. The vessels then are going to merge, those lymphatic vessels will merge and enter into a duct. There's two of them, can go into one or the other, thoracic duct or the right lymphatic duct. And the vessels, they're going to have valves. And the movement of your lymph will depend on your skeletal muscles contracting. So it's kind of like what we learned about veins in cardiovascular system. So medical condition related to the lymphatic system is edema. That has to do with localized swelling. That just means swelling in a specific point in your body or part of your body caused by lymph that's accumulating. Okay. So in patients that, again, I kind of go back to nursing homes a lot, but we have a lot of nursing homes in the area where the patients are bedridden and, they need their move so they don't get bed sores, but that patient can't do a lot of their own movement. They can have blood that can, or fluid that can accumulate, lymph that can accumulate in certain parts of their bodies, particularly lower extremities, because they're not getting much muscle activity or skeletal muscle activity. All right, so this picture shows you a few places in your body that are associated with the lymphatic system. All right, it's kind of hard to read here, but it tells you about your tonsils. These are patches of lymphatic tissue. They prevent pathogens from entering your body through your nose or your mouth, or at least preventing them from getting past. If they come in through your body, through your nose or your mouth, your tonsils are supposed to keep them from getting any further. Here's your right lymphatic duct. It's going to enter its lymph into the right subclavian vein. Okay, we learned about the right subclavian vein in the last chapter on the cardiovascular system. Okay, fluid's getting back into the cardiovascular system. All right, we got some axillary lymph nodes, okay, near the armpit, and they are helpful for immunity. All right, the thymus, okay, just superior to the heart. T lymphocytes mature there, okay, and they're involved in immunity. We'll talk more about what they do later. All right, you have your red bone marrow, where all your types of blood cells form. Your spleen, okay, cleans your blood out, cleanses it from cellular debris and bacteria. You also have lymphocytes there. These are also immune cells, and they are going to respond to the presence of materials your body thinks are foreign. We call those antigens. Okay, here's your thoracic duct, and it's going to enter or empty its lymph into the left subclavian vein. All right. Now here are your inguinal lymph nodes, okay, near the hip, near the groin region, and they can clean the lymph, let your immune system if you're having pathogens there. And here's what the red bone marrow looks like under a slide. You see lymphocytes, monocytes, thymus gland, cortex of a lymph node, and medulla in the capsule, and your spleen. And see what those look like under the microscope. All right, organs and tissues and cells, all right, in your immune system. So that sounds like the Wizard of Oz, like organs and tissues and cells. Oh my, okay. For those of you who are awake, maybe y'all got that. So I know this is not the most interesting topic in the world, but trying to do what I can here, y'all. All right, so with your primary lymphatic organs, your lymphocytes will start out or originate and or develop or mature in the primary lymphatic organs. So what are they? Well, one of those primary lymphatic organs is the red bone marrow. Okay, so with the red bone marrow, you have stem cells there, and they make your blood cells. So you don't find red bone marrow everywhere when you're an adult. You will find it in the sternum, you will find it in the ribs, you will find it in your vertebrae, you will find red bone marrow in the skull. You'll find red bone marrow in the proximal heads of the humerus and the femur. You'll also find red bone marrow in portions of the pelvic girdle. So the lymphocytes will get differentiated into two different types. You have the B lymphocytes and the T lymphocytes. So for B, I would kind of remember that they mature in the red bone marrow. Okay. T lymphocytes mature in the thymus. Okay. Thymus starts with T, bone starts with B. And they are involved in immunity. Another primary lymphatic organ is the thymus gland. It's in your thoracic cavity, just superior to the heart. Okay, it's actually larger in children than it is in adults. It's smaller as you get older. And the lobules of the thymus gland have lymphocytes in them, and they also produce thymic hormones. Remember the endocrine system? Thymus was an endocrine organ. And these hormones help T lymphocytes mature. And it's possible they can do other things for immunity as well. So they're extremely critical to your immune system. So what are your different kinds of immune system cells? Here are your neutrophils. All right, overwhelming majority, 40 to 70% of your lymphatic cells are at least in your lymphatic blood cells are neutrophils. They are phagocytes. So that means they eat things and they destroy bacteria. Your eosinophils, about 1 to 4%. They are also phagocytes, and they destroy what we call antigen-antibody complexes. So the foreign invader and an antibody that your body makes, as well as parasitic organisms, simply parasites. Your basophils, 0 to 1%. It's going to release histamine as well as other chemicals when it gets stimulated. Okay, if you've ever taken an antihistamine, it has to do with these histamines, okay, involving allergic reactions. All right, the lymphocytes, 20 to 45%. You know, the B type makes antibodies in your blood as well as lymph. Your T type kills cells that have viruses in them. And they also kill cancer cells. Okay. So the B cells will make antibodies which can detect foreign invaders or bad things. T cells just go ahead and kill them themselves. Okay. Monocytes, okay, 4 to 8%. They become macrophages, which destroy viruses and bacteria. Okay. All right. So those are the primary lymphatic organs. Let's take a break before we discuss the secondary. I want you to discuss the primary lymphatic organs and lymphatic cells with your partners. You can do this at home as well. Okay, so we actually are going to pick up with secondary lymphatic organs on Wednesday. So I'd like for you to work on your exit tickets, and we'll pick up here next time.